I promise that this video will be brief because I'm very confident that you guys could read through this set of slides and make perfect sense of it because you already have a feel for what it is to take a medical history and how to take a medical history. But today the plan is to add on this last step, which is sort of the extended information, much of which you don't ask a patient every time they come into your office. A lot of it is established sort of the first time you meet that patient. But it is still a really important part of the patient history, and it's still a thing that you have to learn as a new student. So, like I said, I think you guys can read this and make a lot of sense of it. So I'm just going to flip through quickly, kind of add some context in places too. Also, we're getting close to Thanksgiving. So the theme is Home Alone, quite possibly the greatest movie ever made, which is my favorite November, December movie by far, if not my favorite movie all year round. Okay, so first, just some of those pieces of communication to review for you, and some things that maybe were a struggle for people when you did your basic histories a couple months ago. The first one, always let your patient finish their statements and always give them that open-ended start. So why are you here today? And let them give you their opening statement. Always be honest from your end. Don't forget your nonverbal things. So do those eye checks, make quick eye contact, sit down, be at eye level. Don't let any barriers be between you. Obviously, conversational style was one of the biggest things that first time, and it's very challenging, I know, to be more relaxed and conversational, but always strive to achieve that. And then don't be afraid to ask them to clarify if their answers are confusing, and don't forget to always ask what else as you move through your history. All right, so we accomplished the first three parts of this before. Identifying information, chief complaint, and history of present illness, everything about why the patient is there on that day. What we still have to cover then is sort of those extended features that give you a better picture of the person as a whole. Looking into their past a little bit more, looking into their relationships a little bit more. And so that's going to include the past medical history, the social history, and the family history. And then the last part of a full medical patient interview is called the review of systems, which you usually combine while you do a physical exam. But we're not going to learn physical exams, so I'm going to say you're not ready for that just yet. All right, so this slide just reviews what you did previously. We are going to do a little practice review basic history with someone that you'll turn in as a video. And so you'll want to use these ideas. Remember, find out what their chief complaint is with an open-ended statement. Ask them what else you can do for them. Then go through a sequence of questions to try to narrow down what it is that's going on with them today. And at the end of that, ask them what else again. All right, past medical history looks at a patient's previous experiences. So it's not necessarily something that matters to them today in terms of why they called or made an appointment, but these things might help inform you as to what diagnosis you might need, what treatments there might be, what ongoing treatments someone might take, like a prescription medicine and things like that. So certainly there's lots of things you can ask, kind of like with the the history of present illness. You don't necessarily have to ask every single one of these questions for it to be a good history. But you want to make sure that you ask many of them. So, for instance, these first three are sometimes asked every time you go to the doctor. What medicines do you take regularly? Have you had your vaccines? Do you have any allergies? And a lot of times the nurse will check those things with you when you check in at a doctor's office. Now, some of the deeper questions: have you been hospitalized before? Have you had major injuries? Have you ever had a surgery? Which obviously these two kind of tie into hospitalization. More things for past medical history. Have you had any significant childhood illnesses or adulthood illnesses? Now, that's the way you should ask that question so that it remains very open-ended. But a lot of times that will confuse patients. Only if they seem confused and ask you for clarification should you give them examples. So, for instance, if they're like, "What do you mean by childhood illnesses?" then you might say something like chickenpox. Then you might say something like, "Do you have any illnesses from when you were a kid that you really remember, that were something that you had a problem with for a long time?" And then they might be able to tell you about asthma issues or something like that. Same thing with illnesses in adulthood. You want to make that very vague. If they ask you, "What do you mean by that?" then you might say things like high blood pressure or cholesterol issues or anything like that. Obviously, if they've already told you that they take a medicine for something, if you then ask them about adult illnesses and they say none, or they say, "What do you mean?" you might say, "Well, I assume you've been diagnosed with high blood pressure since you take this medicine," or something like that. Have you ever had blood transfusions? That's one of the least common questions you might ask someone, but you could ask them that. Have you ever been pregnant? Is a great question. The reason I put a star there is that you only want to ask females this, right? If you want to look dumb, ask a male patient if he's been pregnant before. He will automatically know that you don't know what you're doing, right? And yes, I've had one or two students ask me that in the past. So don't get nervous and ask guys if they've been pregnant. That's just a question for women. And then one that's very often is asked is health maintenance. And with that, what we mean is that you want to kind of prompt your patient to tell you about their lifestyle. Tell me about your diet. Tell me about how often you exercise. Do you see the doctor regularly? Or have you seen the doctor regularly in the past? And then they'll usually tell you if they think that they diet okay, or if they exercise enough, or if they need to do more. And that's good info, because then you can kind of help coach them on getting more exercise or eating a little bit better or whatever it might be. Now, then the fourth stage is the social history. Now, this really sort of rounds out the patient. These questions are going to feel a lot less scientific, right, and a lot less medical, but they can be really valuable information. One thing you'll look into, family life. Is the person married? If they say yes, you ask them how long they've been married. This is a great place. The social history is a great place for conversation as well, though, right? If you say, "Are you married?" they say yes. You say, "How long?" They say 25 years. You say, "Wow, congratulations, that's a long time. I've only been married for 3 years. I can't imagine 25." Right? And so this is a great way and an easy way a lot of times to get that conversational style into your history taking. Same thing with kids. Do they have children? If they say yes, you ask them how many. If they say 4, you ask them, well, how old are they? And are they boys or girls? And those sort of things. Occupation. Ask about their job. Ask them what they do for a living. Ask them how long they've worked there. Sometimes you might also ask about previous jobs if you think it might have something to do with their diagnosis. So if someone has a lung problem and you're sort of suspecting lung cancer, you might look into their occupations. See if they've ever done a job where they're around a lot of chemicals or things like that. And if you ask them, like, "What's your job now?" and they say they're a teacher, you're thinking, okay, that's probably not something around chemicals. Then you might ask them, "You ever have any other previous careers?" And they say, "Oh yeah, I worked in this chemical plant for 20 years. Right? Then that really informs your diagnosis more. Education sometime asked. It's not super significant, but sometimes it might help to know how educated your patient might be. More things about social history. What do you like to do for fun? What do you like to do in your spare time? These questions, it's not because we really care if a guy likes to work on cars or something, or likes to cook, but let's say that you ask them what they do for fun, and they give you a pretty high risk behavior. They say, "Yeah, I like to ride motorcycles," or something like that. That might also kind of inform your ideas on this patient a little bit. Religion, I would say, is rarely asked. A lot of times you might bring faith into a history if you are talking to someone who maybe has some psychological issues, because a lot of times faith can be very anchoring for someone and things. So if you want to ask them if they consider themselves religious, that's cool, but not something you have to ask. Sexual history, obviously, or sexual activity is often very pertinent. You don't necessarily ask every patient that if they come to you with a head cold, but if you have any reason at all to believe that something could be sexually transmitted, then this really becomes an important question. So, are you sexually active? If they say yes, you would usually ask them to tell you the number of partners. Um, if they're married, oftentimes that number of partners question is a little bit uncomfortable to ask, but also could be very pertinent. And then, do they use birth control? Sometimes matters too, particularly if you're talking about younger women. Last thing about social history is two questions that are often asked every time you go to the doctor. The first one may or may not, kind of depends on your doctor, but an open-ended prompting of talking about stress is really something that's encouraged today, because stress and anxiety affects so many people, that you might say something like I have on the slide is tell me about your stressors. How are you coping with that? How are you handling stress in your life? And this just kind of opens that door for the patient to comment on that a little bit, whether they just say, hey, things are going great, or they actually have something to talk about there. It might help them. And then high risk habits, definitely you get asked very often at the doctor. You've probably experienced this too. The first two are the big ones. Do you smoke? Do you drink? Um, Using recreational drugs? Do you use firearms regularly? Do you wear a seatbelt in your car? Do you have working smoke detectors at your house? If you get a yes for smoking, alcohol, or drugs, you usually ask frequency, because smoking one cigarette a week is a lot different than 10 packs a day, right? Having a drink once every 2 months in a social setting is a lot different than drinking a whole case of beer yourself every 3 days. So you do ask frequency. Most important thing here is you got to be careful not to piggyback. I can't remember if we talked about this previously or not, but you want to make sure that you ask every question individually. So you want to ask your patient, do you smoke? And wait for their answer to that. Do you drink alcohol? And wait for their answer to that. Do you use other drugs? And wait for their answer to that. The reason they say this is actually a psychology kind of thing. And if you piggyback the questions, a person will feel confident answering just one of those questions and moving on. So for instance, if you say, do you smoke, drink, or do drugs? That patient might tell you no, because he does not smoke and he does not drink alcohol, but he might have a terrible methamphetamine addiction. But he sees no problem with telling you no to that question because you asked about smoking and drinking. But if you ask that patient, do you use other drugs? He's probably going to be a lot more hesitant to just say no, knowing that he has that methamphetamine addiction. So make sure that you ask each of these questions separately if you're going to ask them. Last piece of this is the family history. It's pretty straightforward, but basically you're just looking for other illnesses or kind of behavioral trends that run in families. And obviously this is going to be most significant for genetically transmitted or genetic diseases, but also that behavioral piece can matter too. If parents have really bad diet behavior, that often is kind of handed off to kids as well. So things that you ask, right? Are your parents still living? If they say yes, then ask them more details about that. How old are they? That sort of thing. Do they have any siblings? If they say yes, ask them more details. How old are their siblings? They have brothers or sisters. If you want to hear, it's a good spot to be conversational too. You can ask what their parents do for a living or what their brothers and sisters do for a living and those kind of things too. Might ask if there have been any similar illnesses in their family like their chief complaint. So if they come to you today with a sore throat, you might ask them that directly. Anybody else in your family had a sore throat recently? Because a lot of times, that's the case. Then you also would ask about significant family illnesses, any illnesses that run in your family. This is another place where the patient might say to you, what do you mean? And so you can offer them some ideas, right? Heart disease, cancers, diabetes, things like that. But unless they ask you for clarification, just say, any illnesses run in your family and see what they come up with. All right, that takes care of an entire medical history. Identifying info, chief complaint, history of that present illness, past medical history, social history, and family history. Now, this sets us up for what I call the Intro to Clinical Medicine midterm. Now, just so you know, this is not actually part of the official midterm. This will simply be a score for the second quarter. However, it is the culmination of what we've worked on the whole semester in terms of communicating with patients. So, at some point during the last 2 to 3 classes we have before actual midterms, so that spans basically December 10th through the 17th for our A days and B days, you will have to take a complete extended patient history on me as your patient. So everything that we just talked about in this little PowerPoint. You are also not allowed to use a guide to help you. So this will require studying and practicing to do a good job with it. Now, you can go ahead and look on Schoology now. You'll see the scoring rubric for that. You'll also see sort of that cheat sheet that summarizes a bunch of the questions for you. And you'll also see a questions guide that I'll be kind of having in front of me as we talk. Kind of like before, it is not required that you ask every single one of these questions to take a good history. But you should definitely address each of the different parts of it, right? So chief complaint, past medical history, all the different pieces of it. But you don't have to ask every single social history question or something like that. So we'll talk about this a lot more in class before we get there. But basically, closer to those dates, you're going to sign up for an appointment time, and you'll take that history with me during one of those class blocks. The other nice thing for you is that means during those 3 class periods, the rest of the time is yours for review, for preparing for our final, for preparing for other midterms, whatever it may be. So hopefully, while it will be stressful to take a history on me, I'm sure that week will not be a very stressful week altogether because you'll have a lot of time to work on things. Okay, I've said more than enough. Thanks for listening. I'll see you guys in class.